Hello, my name is Dr. Katie Palmer, and I'm one of the physical therapists here at Performance Spine and Sports Medicine, and I'm here today to speak about neck pain and the McKenzie diagnosis and treatment plan that is utilized here at Performance Spine and Sports Medicine for patients with neck pain. So to begin, neck pain affects about 2/3 of the population at some point in their life, and it can be debilitating depending on the severity of the symptoms and the cause of the pain. Those people that experience neck pain can suffer from moderate to severe disability and can affect daily activities from everyday living. Neck pain isn't always just in the neck. It can also radiate to the upper back, as well as the back of the shoulder, down into the arm, the forearm, and down into the hands and fingers. So if you have any of those symptoms, it may be related to some sort of injury that's in the neck. It can also be exacerbated by stresses such as emotional stresses or physical stresses, such as poor posturing at work or poor posturing throughout daily activities. The current research shows a prevalence of neck pain to be between 67 to 71% of the population of people will have neck pain at some point in their lives, and about 10% of these cases become chronic. Over $85 million a year are spent looking for relief from back and or neck pain. And what some of the research is showing us is that there's no evidence of association between persistent neck pain and degenerative changes. So what this is saying is that you may have degeneration that shows up on an x-ray, but this may not necessarily be the cause of pain. So that's where our job comes in into figuring out what is the cause of this neck pain. So just to review some of the anatomy of the neck, we have 7 bones in our cervical spine, and these are the vertebrae of the neck, and they help to protect the spinal cord and cushion it from any stresses. We also have, between these bones lies discs, which act as pillows or cushions for those neck bones, and we also have 8 spinal nerves that exit out of these vertebrae. Any of the nerves that exit out of the vertebrae of the neck will radiate down into your arms or into the fingers. So that's why you may have pain going into these areas as well, as I've discussed before. So this diagram identifies the radiating pain patterns that are sometimes common in patients with neck pain. So again, patients with a neck problem may or may not have problems in some of these areas, but just to highlight that this can be any kind of common pain complaints that we get from patients that have neck problems. And patients can also experience numbness and tingling into these areas as well, so not just pain. And patients are often confused because if they are having symptoms going into the arm or into the shoulder blade or into the fingers, then they think that this is the area that should be treated. And that may be where the problem is coming from, but the problem may also be stemming from the neck. So we would be treating the neck at that time if we decided that that was where the issue was coming from. So most neck pain stems from poor posturing over time. And unfortunately, most people spend their day sitting at a desk or typing on a computer. So because of this prolonged sitting, gravity over time makes it harder and harder for us to be able to sit erect or sit upright, and eventually causes the slump posture. So sitting in this slump posture over time puts a lot of strain on your neck and on your back as well. Our sleeping posture can also affect whether or not you will wake up with any sort of back or neck pain. And over time, these bad habits are harder and harder to break, and our muscles start to lose the endurance to stay in an upright posture. These are just some of the basic reasons why you may have neck pain. So one of the methods that the physical therapists here at Performance Spine and Sports Medicine utilize for neck pain is the McKenzie method. So according to the McKenzie method, a majority of neck pain may be resolved by performing a set of specific exercises. These exercises would be determined at the time by your physical therapist who is trained in the McKenzie method, and all of these exercises are patient specific. So McKenzie also emphasizes the importance of proper neck and back posturing throughout the day, as well as in sleeping positions. These exercises, along with posture correction, is to help centralize pain and eventually abolish the pain. So what centralization means is the movement of a pain from a more distal area to a more central area. So for instance, if a patient is having pain that's in the lower arm or down into the hand, then if a pain centralizes, that means that it's moving to a more local spot. So it's moving from the lower arm or from the hand and into the upper arm, shoulder, eventually into the neck, and eventually the principle is to have the pain eventually abolish from that area. So the pain may increase in intensity, but as long as it doesn't peripheralize or go further down the arm, then we're still in good shape with those exercises. So most patients with neck pain are mechanical neck pain patients, meaning that the pain changes with different positions of the neck and can be changed with specific exercises. So most patients fall into the derangement category, and this is about 80% of our patients are found to have some sort of derangement in their neck. And what a derangement is it's like a herniated or bulging disc, it's better known as. Most disc issues are able to be resolved with specific exercises and posture modification if it is a derangement issue. Also, the other portion of neck pain patients may be a dysfunction patient, which describes shortened tissue, which requires stretching in order to remodel tissue. Another classification in the McKenzie method is postural syndrome, and this is only in about 5% of our patients. And what postural syndrome is you have a normal set of tissue, but just in different sustained postures, that's when the pain comes on. So usually just with posture modification in that situation, you're able to resolve the pain. There's also an other category that describes patients that do not fit into any of these categories, or patients that may have stenosis or whiplash or chronic pain syndromes. So since most people fall into the derangement category, I wanted to describe a little bit more about what a derangement is. So like I said before, a derangement describes a herniated or a bulging disc. And we describe a disc like a jelly donut of our spine. So when a disc herniates, it's like the jelly coming out of the donut. So when that jelly comes out of the donut, it can impinge on surrounding nerves and other tissues, causing pain into the neck or the shoulder, the upper back, or down the arm. So physical therapy can help by using these specific exercises and posture correction to help to push that jelly to go back in the donut. And these exercises can help to provide relief from not only neck pain, but also from patients that are having upper arm pain that might be coming from the neck. It is recommended that you see your local physical therapist for a proper evaluation and assessment of your neck pain.